Housing policy, homelessness, and systemic failures. One of the national government's methods for reducing the housing waiting list was to tighten eligibility criteria and remove applicants, effectively culling the list rather than addressing the housing shortage. While this artificially decreased the numbers, it did not solve the underlying crisis. Now, under another national-led government, homelessness has risen sharply, coinciding with the termination of the information census that tracked these figures. As a result, authorities lack accurate data on homelessness, obscuring the true scale of the problem. This is particularly concerning given the disproportionate impact on Māori and Pasefika communities, who are overrepresented in homelessness statistics and face systemic disadvantages. A breakdown in social services. The lack of reliable data suggests delays in housing, healthcare, and other essential services. These systems are supposed to rely on community agency reports, yet many of these agencies are shutting down due to funding cuts. Without proper monitoring, vulnerable individuals slip through the cracks. Meanwhile, local councils have taken a punitive approach, banning rough sleepers from public spaces and confiscating their makeshift shelters, tents, blankets, and cardboard. Rather than providing solutions, this policy displaces and further marginalizes the homeless. The failure to address root causes. Recent reports highlight alarming trends. Social services report a 90% increase in demand since last September. The Homelessness Insights report found that 14% of people leaving emergency housing remain at risk of homelessness. The council itself admits its failure to support rough sleepers or address complex social needs, acknowledging that economic factors, employment instability, inflation, unaffordable housing, and healthcare access are key drivers of homelessness. Two distinct groups, one systemic failure. The homeless population broadly falls into two categories. Those with behavioral challenges, evicted due to antisocial tendencies, they struggle to secure housing elsewhere because their underlying issues remain unaddressed. Those displaced by economic hardship, they are victims of rising costs, stagnant wages, and insufficient social safety nets. For both groups, the current system offers little rehabilitation or long-term support. What's missing is a dedicated institution focused on rehabilitation, mental health services, and transitional housing. Without structural intervention, homelessness will continue to rise regardless of how effectively governments manipulate statistics or displace rough sleepers.